Welcome, one and all, to Just Massage Therapist Podcasts. I am Chelsea. This is Cora. We are just massage therapists. These are just our opinions. We are just a bunch of other things in our life. We're here just to talk about things. It's just a lot of justs.
Just we're so much more than a just.
Oh, I don't know about that right now. I don't. I feel less than that at the moment.
I see you as more than a just.
I'm very glad that you see me as more than a just. Okay, we are live on there, which means I can press the go live on the Instagram. We are officially live on the Instagram now. Awesome. Where are we? There we are. All right. So, as per usual at the beginning, if you are joining us on YouTube or on Twitch, we can usually see your chats in the chat box. If you're here through Instagram, I'll be going back and forth between here and Instagram just to make sure we don't miss out on any chats or anything that you guys want to say. But feel free to talk to us at any time during. Cora, what is our topic of the day?
Today we're going to talk about how muscles act.
How do they act? Well, they act like little bee birds. No, I'm just kidding.
Well, when you're learning them, it can feel that way.
It really can.
But it's all in how you look at it, though,
Yeah.
right? If you're looking at it and you're memorizing just origins, insertions, actions without an attempt to understand,
Yeah.
it does get really overwhelming.
I 100% forgot to put this on. It can get extremely overwhelming. I was having a really cool chat with one of my clients who is also a massage therapist, and she does neurokinetic therapy, kind of like neuromuscular therapy with a lot more movement.
That's intriguing.
Yeah, it's pretty cool. And she was talking to me when she went and did her neuromuscular training, and having to go through the muscles over and over and over and over and over again. It was fun to listen to. She's a CMT from here, like in California, which means that she took just barely over a year's worth of training. Right, so she decided to go with one of the places that do just over 1,000 hours here instead of the required 550. So she didn't actually learn all of the muscles even in her 1 year of training.
Really? Hey.
So she, taking the neuromuscular stuff, learned the rest of them.
Oh,
Yeah,
that's a lot.
Cool. It's pretty crazy.
That's interesting to see how different programs work.
Mm-hmm.
You know?
You'd think that muscles would be like the number one priority.
We work with them.
That's why you'd think that they'd be the number one priority.
Yeah.
Well, I got my brightness finally up.
Well, hopefully today we'll be able to make them a little bit easier for you.
Yeah, easier to understand and to remember how they work. What is the one big thing that we think about when we think about muscles?
They pull, they're never going to push. Like, that's a big thing always, actually. Like, whenever you're stuck at a muscle, as long as you at least know where it runs and you can follow it, it's what's going to happen when these two parts of the muscle come closer together.
Mm-hmm.
And you're going to get at least one action. At least one.
At least one. Most of them is 2 or more actions.
Potentially, yeah, depending on how it crosses the joint.
Yeah. And muscles have the ability to pull from origin to insertion, so from one connection point to another connection point, or the reverse.
Right. It all just depends on what's stable.
Mm-hmm. Yeah. What do you mean by stable?
Well, for example,
my husband just wanted to say hi.
Hi, Chelsea's husband.
That was fun. All right. Sorry. What do you mean by stable?
Well, for example, like with a like if say a muscle's running from my neck to my ribs, right? If my neck is stabilized and not moving, it's going to be elevating those ribs and helping with breathing. Whereas if I am moving my neck, then I'm not technically breathing too much. So it's going to be acting on the neck instead.
Yeah, the frustrating part comes when you're breathing and moving your neck at the same time, and then it's working on both sides, and it's like, whoa,
What am I supposed to
whoa.
do here? But
All right.
yeah, well, that's something too. Like whenever I think about muscles or when I'm teaching them, anyways, there are main questions that I encourage everybody to ask.
Mm-hmm.
The first one is what joint does it cross, or
Ooh.
joints in some cases, because those are the joints that the muscle is going to work on. If it doesn't cross the shoulder, it can't act on the shoulder, right? So, and that's also going to kind of, in an exam setting, that's also going to give you a term. So it's action of this joint.
Yeah.
So that kind of gives you direction in that too.
Well, I think this is going to be one of those. We should. Oops, not slides. Jeez. We should look at a couple of muscles and
Mm-hmm.
see what you mean by they pull, not push. So I brought up a muscle here. Nice big one. What do you think?
Well, this muscle is actually coming down to some of my other questions here too. So I always ask myself, what joints does it cross? Okay, so in this situation, it is crossing the whole cervical spine. Okay, and for those of you that are not aware, this is the sternocleidomastoid.
Sternocleidomastoid.
And this is actually my favorite question. What's in a name?
What's in a name?
What's
There
in
we
a
go.
name? Well, the sternocleidomastoid tells you a lot of things in its name.
Mm-hmm.
For example, it is going to originate on the sternum and the clavicle. So we have our sternocleido, and then it's going to come up and insert into our mastoid process. So we have our sternocleidomastoid. Okay, so this does cross the whole cervical spine. So we know that it acts on the cervical spine. Well, with its
Bring you back.
attachments.
I need
With
to
its
make you bigger
attachments.
somehow in all of this so people can see your face.
Oh,
But I
that's
also
okay.
want the picture to be better. Here, I'm going to do this. You go ahead with that, and I'm going to figure something else with the
Okay.
pictures.
So it, because of its attachment site on the head, though, that's where the action is actually coming from. Okay. So we want to look at the joints that it crosses, and that's going to tell you where in the body it's going to be acting, and where is it crossing the joint.
Mm-hmm.
Now, in the case of the sternocleidomastoid, it's kind of running from the anterior aspect more so to that posterior aspect. So because it is more so in the anterior than it is in the posterior, we are going to get flexion because anterior muscles flex. Okay. And they're always going to flex. And then we want to look at how it crosses the joint. Okay. Is it crossing beside the joint? Is it above the joint? In this situation, it's kind of beside. Okay. And what angle? So we can see here with the sternocleidomastoid that it is actually running at an oblique angle. When we get that oblique angle, we know we are going to be getting a type of rotation.
Mm-hmm.
Okay. Because the attachment sites have to work at an angle. So we're going to get a type of rotation. And then with the sternocleidomastoid being on the anterior aspect, we are going to get that flexion. And also we want to look at how it runs. If it's beside that joint, we're going to get that lateral flexion.
Mm-hmm.
So this was actually a really great example because most of the questions that I ask myself are in there. So we have a muscle running from the front to more of the back. So we're going to get that flexion, okay, as that mastoid process right here comes closer to our sternum and collarbone. We're getting that flexion. And we are getting that rotation. You can even see mine pop really well here.
Yeah, yours pop so nice. Mine doesn't pop that nice.
And then we also get that lateral bend.
Yeah, and the lateral bend is because we go from a place that is lateral to a place that's medial,
Mhm.
so it's gonna bring it there.
And usually we're gonna, and if you're just kind of like focusing on sternocleidomastoid, it's not typically a true lateral. It's not.
No. The only true lateral that you ever get is between the occiput and C1. So for those of you who don't speak massage speak, the base of the skull and the first uh, spine bone, spinal bone. Don't speak massage. Yeah, I thought you'd like this. This was a good place to start because it literally does hit all of the questions really that you
All
ask
of them.
yourself.
Yeah.
What's in a name? Where is it sitting? Don't you have a what is it? Pigs eat more and fart less?
Oh, almost.
No,
Pigs eat
pigs
lots and
eat
fart more.
lots and fart more. That's what it is.
Yeah.
So close.
Yeah.
I think I have that here somewhere. Hold on, I'm gonna find
And
it.
this is actually kind of yeah, because the pigs eat lots and fart more. So anterior muscles are gonna flex and medially rotate. Okay, we get that flexion, we get that medial rotation. That's what anterior muscles are going to do, where posterior muscles are going to extend and laterally rotate or turn the joint outwards.
I found it.
And this is actually a pretty solid rule. I've had students like, why are you yelling this at us? Why are you yelling this at us? It's because it breaks it down into as cut and dry as the muscular system can be.
All right, is it up
Okay.
there? It's not up there. Why
The
is it not up there?
sternocleidomastoid is.
Sternocleidomastoid looks faster. All right, I'm gonna
Got it
have a
nice and
new
big.
screen and
But yeah, so again, depending on where you are, what region of the body you're talking about, your origins and your insertions are going to be different. Okay, so as we saw with the sternocleidomastoid, the origin is below the insertion or inferior to it.
yeah.
Okay, whereas when we are looking at the upper limb, the
There it
muscle
is.
pigs eat lots and fart more. What does it even
I knew I
mean?
was gonna find it somehow. I knew I was gonna be able to get there. Yeah.
It's there.
Okay. There, I've got it up there for you.
Yeah, so posterior muscles extend and laterally rotate, while anterior muscles flex and medially rotate.
Now, that's not always true, but that
Mhm.
is the normal case.
Well, typically when this muscle breaks the rule, see, as long as it's at an angle, we're going to get that rotation.
Yeah, rotation's
Yeah.
gonna always happen.
But when it comes to muscles, say like the lats, that are a
That's the one.
posterior muscle, but the insertion is still anterior. So it's
I love that
how
our
does
brains are
that,
on.
it's
Yeah.
like, how does that muscle actually run though?
Mhm.
Right? So with the lats, we're coming from that lumbar region, that thoracolumbar fascia, and it's coming up and around to that medial lip of the bicipital groove.
Yeah,
So
let
it's
me find a good picture
posterior.
for it.
So we are getting that extension. And it's also running inferior to the joint. If a muscle is running inferior to the joint, we get adduction. Okay, so we have the lats coming from that posterior aspect to the anterior aspect. So we have that extension. It's inferior to the joint, adduction, but that insertion is anterior. So we get that
Mhm.
medial rotation. So there are muscles that throw you for a loop, but where does it actually live?
Yep. And that's always the thing because you say something like pigs eat lots and fart more. Wow, I'm still trying to learn that one. Right, which is really fantastic and for the most part works, but then you go, but the lats are posterior.
So
Right,
it's
but the
upset.
lats are both. They're both
Yes.
posterior and anterior. You just have to know which part of it is where. So the posterior one is the originating point, which means extension, yes, for sure. But the insertion is anterior. So you can't externally rotate or laterally rotate. You have to come inside.
Right.
Ah, I love it. I love that one. It makes me happy.
Yeah, they're probably one of my favorite muscles to look at.
So yeah, that's right here on the bottom. I don't know if you guys can see my hand moving on there. I could probably do it from. No, probably not. But yeah,
Between
just
your hands.
at the bottom left is the big muscle, the latissimus dorsi.
He's also known as our swimmer's muscle.
Yeah, swimmer.
He's
Yeah.
so pretty. He's
It's
so
been I love that we're talking about this because my entire probably past month or so, I've been trying to put together a list of my basic massage routines, right? And like writing them out and everything. And as I've been going through them, I've been going back through all of the muscles because my routines are always based off of where the muscles are from superficial to deep. And I find this doing the back is the most irritating one to write out
oh,
because of these
salt
muscles
fingers.
and they're like they're layered depths to them and where like this one and this one are the most superficial until you look at this region, in which case they're not even there, so they're not the most superficial, so you got to think about what's there instead and blah 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 blah. It's been quite fun.
You see, it's interesting because mine it still kind of goes superficial to deep, but it more so goes by attachment sites. So when I'm looking at the muscle at the body, and it's like what area is dysfunctional, I'll actually start say it's the shoulder. I'll start at the greater tubercle and I'll work my way down to the depending if I'm starting posterior or anteriorly, but I'll start at the muscles along that bicipital groove,
Mm-hmm.
and then I'll just kind of work around that, and then I'll move on down.
Yeah, to region by region, which for limbs totally and utterly makes sense to me. When I come to the back, and I mean 17 years, and I'm still going, do I want to start here? Do I want to start there? I mean, I'm always directed by the client's body. I'm the therapist. I'm always directed by their body and what their body needs and everything, right? But to actually write it out, like I know what I'm doing when I'm in there. Obviously, I'm like, all right, yeah, let's do this. But then I'm writing it out. And I'm like, well, no, I don't know. No, I don't do that first every time. Sometimes I do this first.
Well, is there always an every time first though?
Well, effleurage.
Fair enough.
That is except for my effleurage, sometimes I do the long sweeping effleurage and sometimes I do more of a ringing effleurage.
Fair
That's
enough.
not actually ringing, but is an effleurage technique. Like so I don't know if I'm ever going to be able to write it down. I can write down my neck basic easy, my arm basic easy, my leg basic easy, my abdominal basic easy. Like my pec basic easy. Those are super super simple to do. But when I get to the back and I start writing it out and I'm like I can't because the muscles are so they're so convoluted compared to the arms and the
Yeah.
legs and the neck,
Yeah.
right? I used to when I first started, and I'm gonna put the picture up here for you to talk about them because I want to hear your explanation of them. But when I first started, I immediately went erector spinae. Immediately, because in my mind, those are the big three. The erector spinae muscles. There are big three back muscles. I'm going to go directly into them without paying any attention to traps, to lats, to serratus, to rhomboids. Nada.
Mm.
I just went, right? And it's taken me 17 years of planning and prepping and hands on and everything to change the approach to be more superficial than deep.
See,
So I'm gonna put that
yes.
picture up for you.
Well, with the trunk, I'll usually go with like the iliac crest, and then I'll work my way up along the vertebrae, and I
Oh.
still do follow like the muscles. So in the trunk, that is my common site that I work from is the vertebrae.
Oh, yeah, that makes sense to be the common site there.
Yeah.
All right, let's replace this with a picture of your paraspinal muscles. All right, so let's use your crazy, amazing logic when it comes to muscles to decode this.
Okay. So first off, let's ask our question. So what region of the body are we in?
all the way from the
Are we
occiput.
anterior or posterior?
Oh, we are posterior.
Okay, so we're gonna definitely get that extension.
All right, extension. Easy. Easy peasy. I love that. That was a terrifying sound.
Yeah, the printer just goes going off. Like, oh, Thanksgiving recipes are printing.
Ooh,
Happy
yay!
Thanksgiving.
Happy Thanksgiving, everyone.
All right, so yeah, so we're located in the posterior aspect, so we are going to get extension.
Extension.
So
Whoop.
now this brings us back to, again, how is it crossing the joint?
All
Okay, so
right.
here it's running parallel. Okay, so because it's parallel, it's a straight line. We are getting true actions. So those true actions would be that extension.
Mm-hmm.
Okay, if you look closely, especially as we come in to our iliocostalis through here, we look at in the thoracic spine or where the ribs are through here, we see that the muscles kind of curve.
Yeah, they
Okay,
do have a bit of a curvy pattern. So as
they
they're
do.
coming up, they curve a tiny bit up near the top.
So technically, we're at an angle.
Oh,
So we're going to get a type of rotation.
yes, we are.
Okay. So now also, they are beside the spine, right? They're parallel to it,
Mm-hmm.
lateral. So we're getting that lateral bend.
Lateral bend. You're right.
Okay. So because it's not the way the fibers are actually running, our origin is distal or inferior. Sorry,
It's okay.
inferior, down by the sacrum, that iliac crest,
Yeah,
that
way
common
down there.
tendon, the thoracolumbar fascia, and the insertions are going to vary. They're going to be in the rib cage, in the thoracic spine where the rib cage is. They're going to be in the cervical spine, and they're going to be in the head. So based on that, it's going to tell you what region it's acting on. So, and it's also going to be pulling to the same side.
What
So
about the
that,
rotation? Is the rotation, what do you think?
well, the rotation would be to the same side because it's not the way that the fibers are running. They're running more superior. So when we get into the abdominals, that's when we're going to get a really good example of how the muscles are actually running in an oblique way that will give us either internal rotation or ipsilateral or same side rotation or contralateral or rotation to the opposite side.
All right, I am getting those
Okay.
ones ready.
So here we are going to get that ipsilateral rotation. We are going to get that pure extension, and we are going to get that lateral bend of the either thoracic, lumbar, cervical,
Capital.
capital. Thank you. I was like,
Okay.
what is it called?
The head.
Head.
Okay, so you want to do the what's in the name? I love the what's in the name for this one. Specifically, the most lateral one makes me the happiest, of course.
Oh yeah. Okay. So what's in a name? So the innermost one, or the one closest to the spine, this is spinalis.
So easy. I love
So
that.
well, and fun fact, it runs from spinous process to spinous process.
Yeah. So it's right next to the spine, touches all the spine processes, and is called the spinalis.
It is.
That's so lovely. I love that so much.
And then we have our longissimus,
The one
which
in the
is
middle.
the one in the middle. Yep. He's the longest. You can see how he is the most fluid of all of them.
Right.
He appears to have the least interruptions. Anyways, he appears
Yeah.
that way.
Appears that way, but in fact, he has just as many interruptions. He's just very bulky.
He's just really long. And he actually starts in at the hip, the pelvis, in through here. And he's actually going to come up to that mastoid process, the same spot as the sternocleidomastoid. Same location.
Yeah.
Okay,
So they
but
both attach back here.
right here. But he runs differently. Okay, so even though he shares that attachment site, he is not running this way.
Forward. Yeah.
He is running this way.
Backwards.
Okay, so we are still getting that rotation, but where that sternocleidomastoid is rotating to the opposite side contralaterally, that longissimus is going to be rotating to the same side, ipsilaterally. Now, he runs from transverse process to transverse process. That's not really in the name. but
No,
it
the
fits
it's
based
he's
on his
just the
weight.
longest one,
Yeah. And then we have our iliocostalis.
which is my favorite.
So iliocostalis, fun fact, starts on the ilium or the hip bone right here. Or I guess you can't see my mouse, but
Can't see the
the hip
mouse, yeah.
bone, and he runs to the ribs.
Yeah. He
Ilio,
also runs up to some transverse processes, but, that's just in the
that's
neck
more up
because
here. Yeah,
there's no ribs in the neck.
truth. Okay,
Yeah.
so what's
I
in a name?
love Iliocostalis, probably my favorite of them because, when you have either an extremely well developed or an extremely overstretched and underdeveloped, you can feel the tendons
Mm-hmm.
so well.
They're one of the easier ones to find.
Oh my gosh, I love finding those tendons. It's of course much funner to find them when the muscle is well developed because then they've got that really good tendinous, sinewy feeling, as opposed to when they're overstretched and they feel like tubes and ropey grossness.
It's satisfying when that releases, though.
Oh my gosh.
Yeah.
I gotta tell you. So this is the reason why we need to know all of these is because as massage therapists, we can do releases on these things. I'm so glad you brought up the release thing. Whew. Today, while working on someone, it was, I can't remember which side. I think it was the right side, levator scapula.
Mm.
Now, lev scap, this beautiful, wonderful muscle that we all love,
Except when it's dysfunctional.
is
When
super
it's dysfunctional
dysfunctional
on you, you don't love it. I
so often.
it's fun to
Anyways,
treat.
it runs from the first vertebrae, right? One, two, three, four. Runs off of the little side processes, the transverse processes, down onto the top of your shoulder blade or scapula. And at the level of the scapula, because we have this awful tendency to use that muscle wrong. We have this awful tendency to, yeah, exactly what she's doing, to hold our shoulders up so hard, and the muscle that is mostly responsible, there are two muscles, but the muscle that is primarily responsible for that is levator scapula. It elevates your shoulder blade.
What's in a name?
Literally what's in a name. So it holds that up, but it can also, while it's holding, help move the neck in extension, lateral bending, a little bit of rotation, not very much, right? So it can do all of this stuff, and then we overuse it to the point where the tendon attached down at the shoulder blade, because it's such a short little tendon, starts to rip and tear. So much ripping and tearing. It's the sore spot that we all feel that isn't the trigger point in the traps. It's that sore spot under the traps, and
The
it's that
ball.
that like yeah the ball basically, and it feels like dunk 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 when you go over it. Right? It creates so much scar tissue. I did a release on one of those today.
So satisfying.
Oh, it was so satisfying. It just it went from don't, don't, don't to brrrt, brrrt.
Winning.
Right? And eventually, after we do a couple more treatments, it'll go from brrrt, brrrt to pup, 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 pup. And I'm so looking forward to that.
That's actually one of my favorite muscles to do active release on.
Yes.
Yeah.
Yeah. Shrug, push down. Shrug, push down.
Well, I actually will engage a fascial stretch with it too. Like I'll get them to the scaling fascial stretch.
Yeah.
I'll get them to do that with levator, where they just like will their hands to reach their feet while I'm
Oh.
pressing it. We hang out for 30 seconds and then they shake it out and we do it again.
And that
Well,
is
take it
exactly
out, not
why.
actually take it out,
Yeah.
but
And this is why we learn this stuff. Okay, I've got you the picture of external obliques.
okay. So here we have our external abdominal obliques. Okay, and they are actually, and again, what's in a name? Okay, external abdominal oblique.
Okay.
Okay, they are originating on the outside of the ribs, the external surface of the ribs. Okay, they are going to, and with that, we have our external abdominal oblique. So they're coming in and they're running sorry, I'm just so used to showing on myself. So they're coming from the outside of the ribs, and then they're coming down to attach onto that iliac crest again, that inguinal ligament. And they are going to, as the origin comes closer to that insertion, they are rotating us to the opposite side. Okay.
Oh, that didn't work. Oh, yeah, that kind of worked.
We'll come this way. That's right. So we're here to here, origin, insertion, we get that rotation. Okay. So they're hands in front pocket. So they are running from that posterior lateral aspect to the anterior medial aspect. Hence our contralateral rotation, or rotation to the opposite side. We see that same pattern with the sternocleidomastoid.
Mm-hmm.
Okay. Now looking at the internal rotation, or the internal abdominal oblique.
That was so perfect timing.
That internal abdominal oblique is actually coming from that thoracolumbar fascia. He spans all through here. So he's also taking over that inguinal ligament, that iliac crest, but he's coming from back here and he's inserting onto the inner surface of the ribs. Okay. Internal. Okay. Now, because his fiber direction is running from that post, so he stands out of back pockets. That's our internal abdominal oblique. Because his fiber direction is running from that posterior aspect to that anterior aspect, we are getting that ipsilateral or same side rotation. Now, we don't see it as clear with the erector spinae, but they are still running along that same side. They are the way that they are because they're pulling. With the erector spinae, it's more of a visual that doesn't have that straight hard rule like the abdominals do. It's more of a visual. What's going to happen? And we know that they do run at an angle. Mm-hmm. They do directly attach to the spinous processes and those transverse processes. So we are going to get a degree of rotation.
So cool.
So cool. and that's a thing, right? So you can sit when you're learning the muscles, you can sit there and you can make yourself blue in the face trying to figure it out, or you can look at them. Mm-hmm. I always encourage that. Look at them because you gotta. It makes sense. Yeah. It makes sense when you look at them.
Yeah, it makes sense when you look at, as long as you are fairly confident or comfortable with your bones. If you don't have your bones down, man, go back to bones. Get your bones and bony landmarks all down, because without those, your muscles just, they make no sense.
You're learning two things at the same time.
Yeah. You want to get your bones down first.
Yeah, because the thing is those muscles attach to the bones.
Yeah.
So when you're looking at muscles that give you hints to the bones they attach on, if you don't know those bones, it means nothing.
Yeah, it literally means absolutely nothing. Oh.
But,
okay, why don't I give a good arm muscle in here?
Yeah.
Ooh, here's a good picture. I like this one. It's got a few in there that we can chat about. We can use that same thought process. Sorry, it takes me a couple clicks to get them. Where do you want to start?
Okay. This is not the one I thought you were going to pull up.
Oh, okay. Which one did you want me to pull up? I could pull up a different one.
No, it's okay. It works. We can work with it here. So we have our biceps. Okay. So biceps brachii. Okay. So we see here, biceps is actually kind of fun for me because we actually have a secret action, I guess, that people don't really think about.
Oh.
Okay. So we have, bi meaning two. Okay. So we have two heads. Okay, so we have our long head, which everybody's like, oh, my long head of biceps. Everybody knows where the long head is. If you've treated it, if you injured it, you definitely know where it is. He is coming in and originating at that supraglenoid tubercle. Okay, so this brings me to a new rule. Okay, if a muscle, because we talked about how if it runs inferior to the joint, we get adduction, right? If it runs superior to the joint, we're getting abduction. Now, because this is its origin, this is very much a secondary action.
Yeah.
So when we say secondary, that means it's assistive. So when you see other actions or muscles crossing more than one joint, know that one is a primary action and one is a secondary action. And that prime or assistive. Okay, secondary, assistive. For the most part. Ish, usually. Rules break. The
Oh, rules
guidelines.
break constantly, but
They're guidelines.
they're guidelines, not real.
But the primary action of him is going to, yeah, muscles are always him, by the way. Muscles are
Why
always
is that? Sometimes I make them hers, depending.
no, muscles are always him. I find when I talk about nerves, they tend to be hers.
Oh, that's interesting.
And ligaments are sometimes hers.
Ligaments are they.
Oh, yeah. See, I don't ligaments are used sometimes they're interchangeable, but nerves are usually like she's sometimes hims depending, but muscles are always hims. There's no
That's interesting.
yeah, for me anyways, they're always hims. But yeah, his primary action is actually going to be at the elbow here. Okay. So he is running superior to that joint. So we're
Mhm.
going to get an assistive abduction. He's an anterior muscle. Okay. He lives right here. So because he's an anterior muscle, he is going to, again, mainly flex
Flex.
that elbow, but he's also going to assist in flexion of the shoulder. Okay, and then we have our short head. Now, this is the one that we always forget about. This is a short head of biceps.
Oh yeah, it's a painful little bugger.
He is, but he makes me happy because he originates on the bone that's named after me. He's on the coracoid process.
Oh my
I
god.
love that. It
Oh
makes me
my
so happy.
god.
I
I
was
thought
like, yeah.
that didn't even cross my mind.
And coracobrachialis. I
Mhm.
love that one too. Makes me happy. He's
Mhm.
right here. He lives right there. It's
What about the
coracobrachialis.
pec minor? Do you also love the pec minor?
No.
That was so straight faced. That was so terrifying. That's her Gemini that just came out, you guys. Like,
You never know which one I'm gonna be. Ask my husband. He can tell you stories.
oh my god. I'd rather ask your sisters. I think their stories would be more interesting.
We don't need to talk
I
about
love these three. I love that we're bringing these three up because these all three have a similar attachment point, right? For the pec minor, it's an insertion point, but for the other two, it's an originating point, and they go in two totally different directions, and they make up this crazy little weird pyramidy triangle thing. Right? And it makes me think of the pes anserine
Oh yeah?
because
Okay.
it's got the three connection points to it, like these three very specific connection points, two of which are kind of similar but not really. They want like
Pretty
kind
similar.
of similarly, but not. And then one that is wildly different.
Boom.
You know, Sartorius and I feel like Sartorius is kind of like crazy wildly different. Going in abduction, external rotation, and flexion. And then you've got gracilis and semi-tendinosis. Tendinous. Wait, no,
Yeah, you're right.
tendinosis. Yeah, I was right the
Tendinosis.
first time. Why am I messing up my words? 17 years, guys, you can still mess up your
It
words,
happens. It happens.
right?
I forgot.
We've got adduction and we've got flexion going on, knee flexion, adduction of the adduction of the hip, knee flexion, and extension. It's like these three crazy, wild, different actions, all having one common attachment point. And here you've got flexion at a different joint, way over here, flexion here, two flexions up here, and then
Kind
a
of a flexion.
protraction.
Protraction, yeah.
Yeah, it just makes me happy. They remind me of each other.
Yeah. Like I like Peck Minor because of his relationship with TOS.
I thought you didn't like pec minor.
Not really. I appreciate him. I appreciate Peck Minor
You
because of his
appreciate pec minor.
relationship with TOS.
That makes sense.
Yeah. I appreciate him. I understand him. I acknowledge him. Kind of like a spider, I acknowledge you. You're important. Don't irritate. Don't act up on me.
Yeah, which it would because the coracoid process.
Yeah.
That little pectoral minor, that little dude in there, he's the shortened one with people who have the rolled forward shoulders like me.
And that's the thing, though, it's those little buggers. The smaller the muscle, the more problematic he is.
Mhm.
And honestly, I personally feel that the dysfunction that happens at biceps brachii and coracobrachialis starts at pec minor.
Probably.
Because of that shared attachment site at the coracoid process, when there's dysfunction in one, there is going to be dysfunction in the other muscles that share
Yep.
that attachment site. It just is, because the way that the force is transmitted through the fascial system, it just is.
Yeah.
So
It's
I don't
so
know.
ridiculous. Any of you who have ever been taught by either Cora or me, or have gone through similar training as we've gone through, you know that muscles don't just straight attach to bone tissue. That doesn't happen. The muscle tissue is covered over with connective tissue, and that connective tissue all forms the tendon, and those tendons meld with the connective tissue that surrounds the bone.
Mm-hmm.
It doesn't directly connect to the bone. So any force transmission is actually happening all throughout that connective tissue. And connective tissue of one thing is going to connect in with 3, 4, 5, 6, 8, 12 other things. So you mess up one, the rest of them are going to have some sort of reaction to that, whether it's compensating or stretching out and becoming torn with possibility of building in scar tissue.
And that's where you're actually going to feel the pain. You're not going to feel the discomfort where it actually starts.
Yeah.
Either. Like you will after, but not initially.
Nope.
So that's kind of an interesting little twist of events.
It is amazing to me how many people I'm like, oh, you got some scar tissue in there, and they've never heard that before from
Oh
someone.
yeah.
And I'm just like, how would you not have heard this? This is like just basics. To me, it feels like just basics. You tear something, the body responds by fixing it with scar tissue, right? Unless it's skin, right, or the liver, basically.
Skin still has scar tissue.
Oh yeah, if the wound is big enough,
Yeah.
skin will get scar tissue. But for the most part, if the wound is small, like what we see in tendons and muscle tissue from micro tears,
Oh yeah.
right? Those things don't just heal themselves with the normal tissue that it was before. It heals itself with scar,
Yeah. Truth.
right? But our liver can be damaged and not be healed with scar tissue unless it's damaged on a wide scale, just like our skin.
But that has to do with the rate that the cells reproduce.
Yeah, exactly. Yeah, it's all about cell reproduction. Our skin cells reproduce fast. Our liver cells reproduce fast. Connective tissue cells, they aren't the same as our skin cells. They're just little cells that like float and move and live inside of the interstitial spaces. They don't create a wall of anything.
Yeah.
They make fibers that create walls, but they don't live like our skin stuff is living in a literal line and a literal wall all around us with no space in between them. Oh my gosh, there's just so much to talk about here. We need to have an entire day just talking about scar tissue.
I agree. We can do that.
Yeah, we should do that.
Yeah,
Like
we can do
connective
that.
tissue, how it works, and scar tissue. I'm gonna put that on a list.
Pin in it.
Put a pin in that one. So yeah, I hope this has been informative and helps you to realize. Can you one more time go over what you do when you see a muscle and like the first quest, like all the questions that you ask yourself?
Oh, okay. Yeah. So the very first question that I ask myself is, what joint is across? That's the very first thing I ask, because you're limited to the range, to the movements at the joint, right? So that process of elimination, it can't supinate if the joint doesn't supinate. Okay.
Makes sense.
And then you want to know where it crosses the joint, because anterior muscles are going to flex, posterior muscles are going to extend. If they run superior to the joint, abduction, inferior, adduction. If it runs lateral, we're going to get that lateral bend. And how it crosses the joint, okay, because again, runs at an angle, we're going to get the rotation. If it's a pure parallel, fiber direction. We're going to get pure actions. We never really did talk about transverse, but if the fiber direction is transverse, it's going to compress. That's all it's going to do is compress.
That's literally it. Yep.
Okay. And then again, what's in a name? Because what's in a name will give you hints whether it's muscle shape, actions, attachment sites, even location. But it's really important, I feel strongly. You should start with understanding the joints of the body, how they move, as well as the bony landmarks.
Mm-hmm.
Yeah, because that is the foundation. And if you don't have a strong foundation, you're going to be trying to tread water when you don't even know how to float yet. Gotta learn how to float.
Yeah. Yeah. You're gonna get leaks in your attic and cracks in your basement.
Truth.
Just like what we talked about last week.
Speaking of which, I actually was going to mention, I was going to use myself as an example last week.
Ooh.
And I kind of forgot. So I have been so used to treating barefoot. Okay, that's been my thing.
Mm-hmm.
I recently went and got a chiropractic adjustment. For the first time in a really long time, my pelvis was actually level. My knees were shot. Like I couldn't. And then at the same time, I also decided, well, I have to wear shoes now. So I'm wearing shoes in treatment. So all of a sudden I had arch support and I have fallen arches. So I had a balanced pelvis and all of a sudden arch support. And my knees were just like, what are you doing to me? So it was an adventure, but I got some barefoot shoes.
Oh, smart.
They're amazing. I have arch support and doesn't feel like I'm wearing shoes. So, yeah.
Oh, I'm so glad that you did that because I know how much you hate wearing shoes when you treat.
I hate shoes. But yeah, no,
Your knees are gonna have to do a full adjustment.
Yeah. Yeah,
Oof.
it's been an adventurous couple weeks
Mm-hmm.
for sure.
I believe that.
And then, yeah, it just was like, I was just kind of looking at my shoes, like maybe my arch support is too much because I do have fallen arches. Like my one foot has like 0 arch. The other one has, I don't know, maybe like I can fit
the
with that.
bare, yeah.
So it's fallen. It's not obsolete, but yeah. So balance, yeah, it's a thing. And then all of a sudden, my shoulders were popping and cracking. Like everything was just aligning and kind of correcting itself after that pelvis was adjusted.
That is so cool. I
Mm.
love that. Oh, I've been doing hip NMT on somebody who's been complaining of certain types of pain, and I'm just like, oh no, it sounds like your capsules are all messed up. Yeah, because her pelvis is okay, right? We're working on it, but it doesn't matter how much we've been working on it. Her capsules are tightening and causing just all like everything to just suction backwards. So she's externally rotating on both sides and everything's suctioning backwards, but her glutes are going bleh.
Oh.
Oh, it's so bad. Oh, it's good. It's fun though. It's fun to work with. And if you're watching this, hi, you know who you are. I'm glad that you're letting me work on you.
Okay.
Okay. Well, this was fun. I enjoyed this one. These are always quite enjoyable and fun for me. So, join us next week where we're talking pain in the brain.
You got it. I'm excited for that one.
Yeah. So, pain in the brain. It's sort of a intro. Just us chatting honestly about everything that has to do with how we perceive pain. And it's kind of just a little taste teaser for what we're doing in March with the CMMOTA or CMOTA, where we're going to be doing another course through them, another online webinar course all about nervous tissue and how pain works with nervous tissue. So come and hang out and we'll talk pain in the brain.
She's the one. If you're curious about the brain, nerves, she's the one.
Maybe that's why you call them she. Because you think of me.
Maybe. Maybe. I just
No.
remember you, like, chucking things at students when you
Not
when
not at students. I never chuck things at students. I chuck things behind
towards them
students.
towards them.
Behind them. Or in front of them.
It was the very first class I ever sat in with her.
Okay, okay.
And she
I
was
was trying
yeah.
to create a startle response, a
It was
visual and
education.
it was intentional visual and auditory, not physical, okay?
No,
Not
she
tactile.
did not physically abuse her students.
No,
It
I
was a
threw things,
reaction thing.
but not
Just
at them. Over top of them. Oh my god, you're gonna get me in trouble, girl.
okay,
Ugh,
okay, I didn't okay, she wasn't throwing with the intent to hit them. She
no,
was
and I never hit
throwing with the intent of teaching them about the gate channels and the
startle
door.
responses.
Startle responses,
Oh
all
my
those
god.
things, and how nerve impulses actually work. And I just remember thinking, like, oh, I wish I went like this. I wish I had a neuro teacher doing this to me for me.
Throwing stuff and scaring
Throwing
you?
flex, I think I would have remembered it.
Yeah,
I
honestly, there are certain things from that class I'm sure people will never forget.
yeah, I don't think they will because I was given a book and it's like, read it.
Oh, that's the
And that's what
worst
it
way to
was.
learn.
That's what it was for neuro. And it wasn't actually until I started talking to you that I actually was like, huh, maybe the brain isn't as dumb as I thought it was.
Let's be honest, it's still pretty dumb. Like, we rely on our critter brains so much still.
But it's in that regard, okay. But I mean, like the inner workings of it.
Yeah,
Like
it's
it
pretty
was just
phenomenal.
neuro was just something I learned to pass the test, and that was that.
Yeah.
But she makes you want to learn it. Beautiful though.
Yeah. Oh. Oh, and we have solidified our, mystery guest. So, 2 weeks, we have a mystery guest. Please come and join us for our mystery guest. We have solidified them.
You'll have to
Uh,
tune in a couple weeks and find out.
yeah. Otherwise, we will, I think we'll say goodnight. Say goodnight, Dick. It's it's an old thing, like, Dick Van Dyke.
Oh,
My parents used to
wait,
say it
wait,
all the
this.
time, "Say goodnight, Dick."
I thought there was somebody named Richard who commented or something.
Oh,
I was
that's
like, we
hilarious.
have a commenter.
No, no, I was just being weird. Uh, all right, fantastic. We will upload this soon, so, if you're watching it after the fact, hi from the past.
Yeah, we're time traveling.
You're time traveling. You're time traveling to the past if you're watching this later. Wow, that was a noise I've never heard you made before.
No.
That was fun. Okay, we should probably say goodnight. All right. Good night, everybody. We'll see you in another episode.
Bye.
Woohoo.